Hello and welcome everyone to our IVF webinar. It's great to be back here once again with all of you, and of course our special guest tonight. As you can see, she is right here with us. This is Klara Havelkova. I hope that I said it correctly. Hi Klara, how are you?
Hi, good to be here.
Thanks so much for joining us and also presenting our topic tonight. Tonight we will talk about IVF legislation, but also egg donation legislation in the Czech Republic. So Klara has prepared a presentation and she will tell you all about the regulations in the Czech Republic, so how it all works. But of course, after that, there will be time for your questions. So as always, all you need to do is just type those questions in the chat section, and Klara will answer them for you. And as she is the medical treatment coordinator at Klinika Unica Clinic in Prague, she has been dealing with patients for a couple of years right now. Klara will tell you a bit more about herself later on as well. And she has experience, she has knowledge. So of course, don't miss the opportunity to ask your questions. She's dealing with the patients at all times. She has been very busy tonight. I know that as well. And I'm very happy that you agreed to present with us tonight. And let me just mention that my IVF Answers, we are part of European Fertility Society. And we are simply here because we want to give you the chance to meet fertility experts, coordinators, psychologists, fertility coaches, anyone that can actually help you out on your IVF journey. And as you know, we are here every single day and we will be here till the end of July. There are some more events coming up as well. So as always, thanks so much for joining us. And now I believe it is time to start our presentation. Klara, ready to go?
Yep.
Perfect. Thanks so much. And there's your presentation right here.
Thank you. It's very nice to be here. So I'm going to start with our presentation that we've prepared for the topic IVF legislation in the Czech Republic. And so who are you talking to, or who you would be talking to? I am the medical coordinator at the Unica Clinic in Prague, and I have been doing this for several years now, and I am more focused on the medical part of the treatment. So if you got in touch, you would deal with my colleagues first, and then I would take over as whether for the consultation or afterwards for the treatment itself. So I would be the one kind of like the connection in between the patient and the doctor, and of course the nurses as well. I do focus on English-speaking patients mostly. And so Unica is a IVF clinic. We are based in Prague and Brno in the Czech Republic. We do have patients from, of course, the Czech Republic, but mostly from abroad. And we do have coordinators who speak different languages. So I would be focused on the English-speaking patients, but we do have coordinators who speak German, French, Italian, Polish. So I think that the patients have a lot of languages to choose from to feel more comfortable and more welcoming, because of course, you know, speaking in their own language makes it easier for them to understand everything. We are, of course, available for the program with donated eggs. We do have a very large database, so one of our big advantages is that there is no waiting list. The database is very large. It's over 1,200 active donors now that we have. And so we've been trying to definitely focus on that. And the whole pandemic or the COVID hasn't really affected that, which is very good. And we are focused also on the holistic fertility program. So we do focus on kind of like the individual approach when we have consultations with the doctors and the patients based on their, of course, medical history, but also what they feel comfortable with. The doctor would suggest different techniques or different holistic methods that could be used during the treatment as well. which can reduce the amount of stress, of course, and the patients could probably feel a little more relaxed. And as a show off, we did win an award last year for the experience during the IVF treatment and the best fertility blog, which is something to be proud of. Moving on, as I said, we are based in Prague and Brno, so the biggest cities in the Czech Republic. And these are the two legislations that we have to follow. So, of course, we do have different laws that have to be followed, even when it comes, especially when it comes to the egg donation program. But I'm going to talk about that later, but just to show you what we have to follow, which is the European Union one and also the internal one of the Czech Republic as a country. So moving on to general legislation, what we do have to follow is that the maximum age is 49, and it is the very day of the patient's birthday would be the day of the last chance of having a transfer. Then as they reach, or the women, as the women reach 49, then unfortunately we can no longer provide services or any treatments for them. We do transfer maximum of 2 embryos. This is something that's not given by law, but it is something that we follow as a clinic. The doctors always highly recommend a single embryo transfer, but of course I do have patients who feel like they want to transfer to. The thing is that we also tell our patients is that they're not doubling their chances by transferring 2 embryos. It only increases by about 10 to 15%, and also the risks get a lot higher. For example, the risk of having a C-section later on or different complications during the pregnancy itself, those are higher. So that's why we do recommend, or the doctors recommend, single embryo transfer, even though, of course, we, as I said, we do transfer to if that's what the patient's wish is, but no more than that. We cannot treat single women or single males. We cannot treat same-sex couples, and what you can see, the strict controller of the Czech IVF clinics would be the SUKL, which is something that controls the clinics, different protocols, the labs, of course, how the patients are treated. The whole egg donation program, of course, is strictly controlled by this authority. So it is like the highest authority we have in the Czech Republic for IVF, and we also, of course, get checkups by them. So they have to make sure that we follow these legislations. And moving on to genetic testing. What we do provide is genetic testing. For example, these two that are written here, the PGTA, which is a pre-implantation genetic screening, and it is basically a biopsy on the embryos. So when we, of course, do the combination of the eggs and the sperm, and then on the embryos, the embryologists do a biopsy, and the sample is sent to an external lab still in Czech Republic, and the results take about 2 to 3 months, and then basically what we get is a result which says if the embryo is suitable for a transfer or not. This is in general, genetic testing in general, and PGTM would be focusing on specific genetic disease. So if the patients, for example, already know that either one of them would be carrying this specific genetic disease and they already know what it is, then the embryos can be tested for this specific issue, which of course then as we get the results, we of course pick the one that's not a carrier and that would be suitable for a transfer. We are not allowed to share the sex of the embryos, only if there's of course a case of a very specific genetic disease that would be risky. Then of course we would share this information, but normally it's something that again is not allowed, and we're not allowed to do gender selection. So telling the patients the gender of the embryo so they could choose. Moving on to egg donation legislation. So the donor program, I kind of talked about it at the very beginning. It is strictly and completely anonymous. So it is something that is, again, given by law. So we cannot share any pictures. We cannot share any background of their families. What we can share is just basic information. So their height, their weight, their eye color, hair color, blood group, if that's what the patients would be interested in, and of course some hobbies and education. But this is it. No pictures can be shown to the patients. The donors are definitely available, as I mentioned at the beginning. We do have a very large database, so there's no waiting list. I haven't had an issue with the patients not being able to choose the donor profile that would be matching them. The selection is very wide. The matching would be, of course, depends on the patients. So we do ask for pictures. If the patients are willing to share their pictures, then that's what we do. And my colleague who takes care of the donor program does the matching. So she would be picking the profiles for me, and then I forward them to the patients. It depends. We do have different on the price list. We do have different packagings, but they can choose from one donor, which one profile that is given to them by the clinic itself, or 3 or 5 donor profiles that they can choose from. So the patients can feel more that they're part of the process. We of course do have to follow some restrictions given by law of the Czech Republic, which would be of course genetic testing. They have to go through a gynecologist, genetist. They have to be under 35. Mostly the donors at the Unica clinic are not even over 30, and of course they go through all kinds of tests, karyotypes, STD tests that we have to do again as a clinic because that is the law of the Czech Republic. So they're definitely tested for a lot of stuff. We make sure, of course, they're healthy because we want to make sure that the outcome of the therapy will be a successful pregnancy and, of course, a healthy one. The sperm donation legislation is pretty much the same. Again, it is anonymous. The amount of male donors is the same as female donors. We do have a large database for male donors as well. The matching is exactly the same as explained before. Again, the maximum age would be 35, but usually they're not even over 30. So this would be the same process. Then embryo donation legislation, which would be again very similar. It is anonymous. The embryos are of course created with a sperm sample of a donor and the eggs of a donor. We are not allowed to use any embryos that were embryos of our patients. So if I would have a couple who's they had a successful pregnancy and they do not wish to use their embryos anymore, we cannot as a clinic in the Czech Republic, we cannot provide them for other couples. Even if the patients agree with it, we wouldn't be allowed to do that. Definitely, it is always, the best quality sperm is mixed with the best quality eggs, and then the embryos are frozen at our clinic, and they can be used for patients if that's what they wish to, if that's the treatment they would like to go through. And of course, all the testing would be included in that as well. So these are the holistic fertility methods that we have. The methods are very individual. Some patients are interested, or they wait for the doctor to kind of recommend what they think would be the best. We of course do have a psychologist that the patients can talk to, because of course we know that the IVF as a IVF journey is always difficult, and it's going through a lot of emotions and a lot of even issues. If they're running into stuff that and it's still not happening, it's definitely there's no shame in talking to someone who can help them and who can kind of provide them support and kind of especially an emotional support. Of course, we as coordinators we're there for our patients. We try to talk to them anytime we can, anytime they need it. But of course, as a psychologist is a psychologist. And what I am the most familiar with, what my patients use the most, is the acupuncture, which is usually before and after the transfer, so they can kind of relax and prepare for the procedure. And then once the procedure is done, then they have another session to kind of again get into a positive mood, get relaxed, because of course it's a very nice environment. If you like acupuncture, then it's definitely something that can help. And then we have different things such as meditation and fertility yoga. So whatever the patients would feel the most comfortable with, it's definitely something that we focus on as well. And that would be it from my side for the presentation itself. And then, of course, if there's anything that I could help out with, or any questions, I'll be happy to answer.
Perfect. Thank you so much, Clara, for your presentation, for taking us through the legislation in the Czech Republic, explaining step by step how it all works. And of course, right now it is our Q&A session. So it is your time to type the questions in the chat section. And if there's anything you would like to ask, anything that is you are interested in, go ahead, type those in. We need to wait for those questions. So before we start, let's wait. But let me ask you maybe if you can share with us what is the current situation with COVID, etc. Are there any, maybe not restrictions, but how are the patients coming in the clinic? Are there any problems? And if so, what kind of problems you are usually need to deal with?
So this is definitely a common question. We do have patients coming in every day. It differs country by country. So of course, my colleagues who deal with German-speaking patients, they know exactly how it works with Germany. French-speaking coordinators know exactly how it works with France. But we're trying to kind of keep up as much as we can. Different countries, patients have to quarantine as they go back. I know, for example, the UK, they have to, as they come to the Czech Republic before their departure, they have to have a PCR test that is ideally not older than 48 hours, but it could be up to 72 hours. And then as they come back to the Czech Republic, as they come to the Czech Republic, they should repeat the test. We do provide COVID tests, the PCR tests at our clinic. So that's something, at least something that the patients can rely on, that they'll have a place where we can do the PCR COVID tests. Usually we have the results within the same day, in the evening, or within about 24 hours. When it comes to the restriction in the Czech Republic, a lot of them have been lifted. It's getting a lot better. Right now, the restaurants are open. We only wear the masks, and of course, at the clinic, we have to wear the masks. But in public transportation, but so far for the past couple of weeks, a lot of the restrictions have been lifted. So the gyms are open finally. The restaurants, bars, places where you can get coffee, stuff like that, those are open. Hopefully they're going to stay open for a while.
Thanks so much for answering that additional question. Definitely reassuring. And yeah, fingers crossed it's going to stay that way. It's been enough of that as well. But let's wait and see what happens, of course. Okay, Emma has added one of the questions that I think that maybe you do received as well before. Do you think the law will change in regards to treatment for single women?
That is really something that I cannot predict. I kind of feel like it's definitely not going to change anytime soon. I don't think. If it ever will, I really don't know. But I don't think it's going to change anytime soon.
Of course, that's just like that. So unfortunately, nothing we can do about that.
Yeah, definitely. That's one of the rules that simply cannot be changed.
Of course.
And for now, I don't think that's an option, and I don't think it's going to be for a while still.
Okay, thank you still so much for your question and your opinion on that as well. Okay, how about egg freezing? Is it possible in the Czech Republic?
Yes, egg freezing is possible. The process is the same. Of course, the partner, we can treat couples. But in this case, for egg freezing, of course, it could be just women. They don't have to have a husband or a partner.
Oh, okay.
As long as they're not going to use the eggs. But the process is the same. They would go through a consultation with the doctor, and they would, of course, be given a therapy plan. They would be stimulated, and then the egg collection would happen, and then the eggs would get frozen, and they would be, stored in our lab for further usage. But once they get used, again, since we can only treat couples, we have to have the partner.
Exactly. So it's possible even if you are single, but that means you cannot use them. You can use them when you will get, let's say, partner.
Exactly.
And then it's possible. Okay, that's still it's still possible. The good news is that it's definitely possible.
Yes, the egg freezing definitely is possible.
Excellent. And I believe that it's regarding the egg freezing, right? So how long is the whole process
of egg donation therapy? Probably.
I'm not sure, so if you can
I
clarify.
can just kind of say
but if you are able, exactly, if you are able to.
So we, of course, the therapies are similar, but being stimulated, meaning that the couple is using their own eggs and their own sperm sample. Of course, it's a lot more difficult for the woman because they have to use injections every day, and then they have to go through anesthesia, and they have to get the eggs collected. But when it comes to timing, the timing would be pretty much the same. It's about 3 weeks altogether. The treatments start with the first or second day of their period, of the woman's period, and then with the therapy with their own eggs, they go through multiple ultrasounds because we have to check the follicles where the eggs would be hidden. Later on, we can see them under the microscope after the egg collection. So what we can see on the ultrasounds are follicles. And so those have to be checked more often. Then the egg collection happens. And then, of course, according to the doctor and also the embryologist, 3 to 5 days after the egg collection, the transfer would happen. The eggs get fertilized on the very same day as they're collected. So they get collected and they get fertilized with the sperm sample. With the therapy with donated eggs, it's when it comes to the medication, it's usually a lot easier because they only use medication orally, and then later on they apply medication vaginally, and usually 80% of the patients only need one ultrasound, and then we of course have to coordinate the donor and the patient. Then the egg collection happens. We need the sperm sample the same day so the eggs can get fertilized, and then 5 days later would be the transfer. But time-wise, it's very similar. It's about 3 weeks altogether.
Wonderful. Thank you so much for answering. And yes, I guess this is the answer that the patient was looking for. The follow-up is how many times I need to visit the clinic?
Mm-hmm. So that really depends on the patients. Some of the patients wish to have all of the ultrasounds at the clinic, which is definitely possible, and that way they would have to come over for the at least 2, maybe 3 weeks if they really wanted to come for the whole treatment. If not, especially with my patients from abroad, it's simply not possible to take vacation for 3 weeks, which we completely understand. Then the ultrasounds can be done abroad with the local gynecologist. They just send us the results, they send us pictures, I forward these to our doctor, and they can give them a feedback. So this is how it works mostly. The only thing when it comes to the therapy with their own eggs, we do prefer to have the second or the third ultrasound at the clinic, because the doctors, of course, want to do the ultrasound themselves, because then it's going to be them collecting the eggs. So they wanna see the final situation before the egg retrieval. But regarding the therapy with donated eggs, I do have patients who come for a week, which means for the fertilization and then for the transfer. Or they even have sometimes the partner come in for the fertilization only, and then the female patient, of course, coming over for the transfer only. So then it would be really just 1 day for each partner, and then they can just go home. So that this is very individual. Some patients feel more comfortable being at the clinic or being available for us anytime, so they come over for the treatment. And some patients who live further, then they could just come for a couple of days or a week max.
That makes perfect sense, and I guess you are the person that can help with that, finding out which one is the best. You are in touch with the patients, and that's how you, decide which option is best for the patients, right?
Yeah, definitely. I mean, I can tell them the options, and then they, choose whatever they're the most comfortable with. And I also tell them what the doctor recommends. So yeah. I can tell them what we would prefer as a clinic, because the doctors, of course, do have their own recommendations. But especially with my patients who live, they live far. They even live in the United States, so they cannot simply just come over anytime. It has to be planned in advance. Of course. So in these cases, of course, we look, deeper into it, and we really try to schedule it as much as possible, even though it's still dealing with human bodies, and we cannot predict everything
And now what's going on still, I guess it's not so easy to travel after all.
And
so
yes,
it's
on top of that,
thing.
yes,
exactly.
On top of that, you have the COVID restrictions in general, and that makes it even harder.
Yes, but it's good to know that still it's possible. There are ways.
Definitely.
We just sometimes it may take longer, but it's still possible.
No, we do have patients coming every day to the clinic. We kind of got really good at it. We learned how to deal with the COVID restrictions. So the more time passes, the better we get at it. So I mean, as coordinators, we follow a lot of the rules and read all the embassy articles and stuff. So we can definitely help out, and it's been working really well, especially the fact that they can do the PCR tests at the clinic. That definitely helps the process.
It's much easier, faster as well, right? So that's good to hear.
Yes.
While we are waiting, if you don't have more questions, we will be slowly finishing. But before we do, I also want to ask you about the donor matching. How does it work? How it's done at Unica, but also in general in the Czech Republic, if you can tell us a little bit on that as well.
So what we do, of course, again, it's an individual, but mostly what we do is we ask the patients if they're willing to share pictures with us. So they can share their pictures, or they can even tell us what their requirements are.
And if I may interrupt, and what kind of photos you are requesting, like the up to date,
yes, or the most recent.
Okay.
Usually, if they would like the donor to look, you know, I don't know, for example, blonde hair. You know, if the patient's blonde, then of course it would be something we would focus on. So the pictures help. But if the patients don't feel comfortable sharing, if the patients don't feel comfortable sharing pictures, then they can just tell us their height, weight, eye color, hair color, as much as we can get. Of course, that makes the matching easier for us.
Right.
Or not for me. I don't do us as coordinators. We don't do the matching. It is our colleagues who take care of the whole donor program. So we would forward these pictures and requirements to my colleague, and she does the matching. So she would then forward the profiles to me, and of course I translate everything for the patients, and I forward the profiles, again, only profiles, to the patients. So if sometimes I do have patients who are more interested in the hobbies or education, so that's definitely something we can share, but no more than that.
Okay, and you can give like a few examples to the patients, or how?
That depends. We do have different packages. So the standard one would be that the clinic simply finds the best match for the couple, and that's the one that's given to them. With an exclusive package, we do the 3 profiles that match them the most, and they can share from those. And then there's an exclusive plus, which is 5 donor profiles.
Okay.
So it's still donors or profiles of donors that match them the most, but the patients have the option or the opportunity to pick themselves, to have more of a selection.
Okay, makes perfect sense. I mean, of course, definitely. Thanks so much for answering my additional question as well. And we will be finishing for tonight, but thank you everyone for joining us tonight, for your questions, and of course for listening. I know that if you are listening, that means that you find it useful. Of course, it has been recorded, so you can definitely watch this. It will be available tomorrow on our site as well. But before we finish, Clara, is there anything you would like to add?
I would probably saying that, you know, it seems to be hard to travel. It seems to be difficult, but we can really help out a lot. We are focused on individuals, so whatever the patients need, we really try our hardest to help out and to get it for them. So definitely, you know, more potential pregnancies, more potential babies, hopefully. And it's something that we always focus on and try to help out. So definitely we are here for the patients, and even afterwards, if there's anything, they can just contact the clinic if they're interested.
Yes, and right before we started, I have seen how it works actually. Yes, so it was an emergency, and even before the webinar, Clara definitely needed to take that phone call, and I know that they are working hard to make it happen. So, but it's amazing that, you know, you are there. I mean, patients can definitely get in touch and you know, fix something that is you know, happening or whatever they need. Yeah, so it's amazing, definitely. And I've seen this myself just before we started. So thanks so much, everyone. It's been great to have you here, Clara. Thank you for presenting, but also for answering all the questions as well, for my additional questions too. And of course, as I've mentioned, it has been recorded. You will be able to find this on My IVF Answers. And if you go to our YouTube channel, you know that there are over 360 webinars so far already. So plenty of topics to choose from. If it's something that you are looking for, it's a good place to go to find out even more. And of course, as you know, we will be back tomorrow at 8 p.m. UK time, another topic. This time we will focus on IVF legislation in Portugal. So, well, I hope to see you tomorrow here as well. Clara, it's been a great pleasure to have you. Thank you so much. Enjoy your evening, everyone.
Thank you.
Take care.
Bye.
Bye.